Good afternoon. I'm Michael Mize, student physical therapist at Campbell University. I will be teaching and demonstrating the Bunnell-Littler test today. This test is used to assess whether a flexion restriction of the PIP joint is due to tightness of the intrinsic muscles in the hand or due to restriction at the MCP joint. The anatomy that is targeted by this test are the long finger extensor tendons and the joint capsule that surrounds the MCP joint. While referred to in many search texts and articles, no literature search produced results pertaining to the specificity or sensitivity of this test. This test is performed with the patient sitting with the arm and hand on the plinth. The therapist holds the patient's hand and places the MCP joint into a few degrees of extension. This puts the intrinsic muscles on stretch. Then, the therapist attempts to flex the PIP joint. If the joint cannot flex, intrinsic muscle tightness or joint capsular contraction should be assessed. From the same position, the therapist then flexes the MCP joint and attempts to flex the PIP joint. If the joint now flexes, this is indicative that the intrinsic muscles are tight. If the joint cannot flex, this is indicative of a joint capsular restriction. Be sure to always test the non-involved side first before testing the involved side to compare bilaterally. Now I'm going to explain and demonstrate how I perform the test on a patient. Lee, I'm going to perform a test that checks the muscles in the back of your hand. I want to see how your finger bends and how it extends. So what I'm going to do, if it's okay with you to perform this test, I'm going to put your knuckle in extension, and we'll bend it up, and I'm going to check and see how the end of your finger bends. Then I'm going to reposition your knuckle, and place it down, and I'm going to check and see how the end of your finger bends. Is that okay with you? Alright. So first we're going to put your knuckle, we'll bend it up a little bit. Extend your finger straight out for me. Okay. Alright, now relax. Okay. Now we're going to bend your knuckle down a little bit. Extend your finger straight out for me. Okay. Now relax. Okay, good. What this test tells me is that with your knuckle bent up, if the end of your finger cannot bend down, it tells me that you have some tightness in the muscles in the back of your hand or the fibers that surround your knuckle joint. Once I bent your knuckle down, it took that pressure off the back of those muscles. If the end of your finger can now bend, we know that the tightness is coming from the muscles in your hand. If the end of your finger can still not bend, we know that the restriction is coming from the knuckle itself, and we have different techniques we can use to work on that.
Okay.
But your knuckle joints and the hand muscles in your hand has to be normal. This concludes my demonstration of the Bunnell-Littler test.